Homeless shelters across the country are seeing an increase in older adults at the door. The latest data from Ottawa's National Shelter Study shows 23.4% of homeless shelter users are 50 and older. At the Union Gospel Mission Shelter in Vancouver, 1 in 3 users are aged 55 and older. That's up from 1 in 4 before the pandemic. That is leading shelters making adjustments to support the needs of an aging unhoused population. For more on what's happening, we're joined in studio this morning by Glenn Van Gulik. He's with the Salvation Army. Good to have you here.
It's a pleasure. I was here 6 months ago seeing Kelsey about our Christmas kettle campaign, and
now
great
you're
to be back.
Now you're back highlighting what is going on. Listen, this is an interesting story, and we're going to talk about that age range in just a moment. But
sure.
Our broken healthcare system is really feeling the pressure of our increasing aging population here in Canada. The number of Canadians aged 65 and older is expected to increase to 10.4 million people by 2037. So what does an aging population look like in Canadian homeless shelters? And of note is the fact that you start counting this at 50 and 55 and not 65. There's a reason for that.
Well, there is. You know, as we look at those that are experiencing homelessness, certainly at the age of 55, chronic homelessness has a different impact on people. And so the aging actually starts to reveal itself in many different ways, a little bit earlier perhaps. But for the Salvation Army, we operate a number of programs and services, not just shelters, of course. We have long-term care homes and the like, the Toronto Grace Health Centre here downtown Toronto. And so we have that experience and that understanding of some of those unique challenges that individuals of that age might be experiencing, certainly as it relates to homelessness.
We're going to talk more about that. You've mentioned the unique needs of older adults who are experiencing homelessness. So what are some of those needs? Well,
in many cases, you know, we think about homelessness and we see a picture in our mind of someone. And that is so uncharacteristic of the broader scope of those, that diversity of those that come to see us in need around homelessness. You know, when we think about the unique needs, some of those might be the basics of medical care, some needs around undiagnosed or unsupported diabetes. Maybe it's dementia that's setting in, those that have physical, medical impairments, but maybe mobility challenges. And so when they arrive at the Salvation Army's Islington Senior Shelter, specifically here in Toronto, they're presenting with some unique needs. Maybe it's hearing loss that we can start to address with community partners.
You know, it's even the, I don't want to say simpler, but less complicated things, even like doctor's appointments or follow-ups or picking up medications.
Yeah, the simple things. I mean, you think about a senior in day-to-day life. Maybe it's your parents or mine who might have specific needs. There's nobody there to help some individuals in our society, and that's why the Salvation Army's.
Listen, when you're unhoused, you don't even have a cupboard to keep your medicines in, right? You've got to carry it with you.
You do.
The Salvation Army runs a homeless shelter for seniors in the city of Toronto. So what kind of adjustments have you put in place to make it client-specific?
Well, I mean, first and foremost, our team at the Islington Senior Shelter are focused on housing. And that is one of the priorities, making sure that we can get people housed with supports, the supports they need. But as we look at those supports at our location, we're thinking about accessibility being number one, wide door openings, you know, accessible areas. We think about the dietary needs of individuals. We've got a great partner, Sodexo, who's come on board recently with a nutritionist, helping out with some of those things. So, you know, as I said earlier, those that might be experiencing diabetes or some other health concerns, high blood pressure, we can address those through those types of nutrition programs.
No, you really highlight well the fact that that specific population gets squeezed in the fact that there's less beds in hospitals. So if they've got chronic care or high needs, there's less space for them. And then if they're not housed, where do they go? They go to places like what you have.
That's just it. You know, I mean, as we think about individuals who might come to us, maybe a partner has passed away and they are left without any support system and perhaps aren't used to having to take care of the day-to-day on their own and find themselves needing support. And the Salvation Army's there. That's an impossible choice nobody should have to make. And so when they come to us, we want to make sure that we can support them, get them back into supportive housing as quickly as possible.
You are one shelter of thousands in this country. What do our shelter system need to be able to support an aging homeless population?
We need housing. That is number one. We need first and foremost housing available with those needed supports for individuals. I mean, as we think about the supports around a senior, community is a big part. That plays a significant role, having friends and neighbors that are experiencing some of those similar things. But as we look at beyond that scope, making sure that there are those day-to-day supports for individuals that don't get lost in the gap. The Salvation Army has always been a gap filler, finding spaces where individuals need support that aren't getting them. And so if people want to support the work of the Salvation Army, you know, the Islington Senior Shelter or more broadly, salvationarmy.ca, learn more about the programs and support the work.
Definitely worth looking into. You know, if you have an older adult in your life, it is hard to imagine them being unhoused, living with all the conditions that they do.
So true, yeah. I mean, my grandmother lives in a long-term care home, and, you know, I think about that every day. What would it be like for someone her age not having a place to go? And I would want someone like the Salvation Army to be there to pick them up and journey with them.
Glenn Van Gulik, always good to have you here. Thanks for coming back.
A pleasure. Thanks, Anne-Marie.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.